Hey guys, welcome back to another episode of 5 Minutes with Your Doc. I'm Dr. Jeff Teeter, and this is Titan Health, Direct Primary Care. Today I thought we'd talk a little bit about what direct primary care is, what I do here in the office, and how direct primary care may work for you. Stay tuned. So, what is direct primary care? Well, DPC is a way to bring you the health care you deserve without the hassle of insurance companies. Insurance first came around in the 20s and 30s with Blue Cross, and it was actually something similar to what I do. They paid the local hospital in Texas $6, which guaranteed that they would have 21 days of coverage at that hospital. Since then, it developed into Medicare, Medicaid by the 1960s, and we had a wide variety of insurance programs, and more than 90% of the population had insurance. It has continued to build and build into the monster that we see today. So here at Direct Primary Care, we offer you medical services for a simple monthly rate based on your age. And for that, you get access to numerous features, which I'm going to show you now. Oh, hey there. I'm just making myself some tea. But this isn't the break room. This is right out in front of Titan Health, right in the reception area. You see, we want this to feel more like home than some sterile doctor's office. We want you to feel comfortable. And if a little tea helps you to do that before you come in and see me, cheers. Hey, when was the last time you sent your doctor a text message? Most of you might say, well, never. When was the last time you called and were able to speak directly to your doctor about an issue that you were having? Again, most of you will say never. Well, here at Titan Health Direct Primary Care, you have unlimited access to your doctor and direct access to your doctor. You can call me, text me, send me an email, and if you can't make it in, we can even Skype to take care of what you need when you need to have it taken care of. We also have same-day, next-day appointments, so that if you have an urgent need, and I have the availability that day, I'll get you in right then. All of that is brought to you through the power of direct primary care. Have your labs drawn directly in-house for low cash-based pricing. I have an agreement with LabCorp and can bring you your yearly labs, which may include CBC, CMP, lipid profile, and hemoglobin A1C for $11, which is cheaper than some insurance copays. One of the Titan Health patients started seeing us simply because of the lab prices. She was paying over $2,000 cash for labs that were required by another physician because her insurance company wouldn't cover them. She came here to see me and asked what I could do. And I got those exact same labs for a total of $85. That's the power of direct purchasing, whether it be with a physician, paying them directly for their services, or through a corporation like LabCorp. If they don't have to worry about collecting from insurance companies, they're willing to give you a better deal. It never ceases to amaze me just how much of a markup there is at the pharmacy. And we're not just talking 50-60%, we're talking hundreds of percent markup. With direct primary care, your physician can directly purchase these medications from the wholesaler. And at Titan Health, we charge an additional 10% from cost. And that's simply to pay for the packaging. That brings the savings directly to you, and you can get medications like your blood pressure medication, lisinopril, for 64 cents a month. I can get metformin for an entire year for most people for $5 to $10. Well, hey doc, what about procedures? Do you do those? Well, of course I do in-office procedures. If you get cut and need sutures, I can do that for you right here. If you're one of the unfortunate individuals that has migraines, I have sumatriptan injections and other medications that we can use to take care of your migraines. For those of you with osteoarthritis and knee problems or shoulder problems, or you just need a steroid injection as a trigger point injection into an area that really hurts, I provide those here, and all of that is covered with your membership. You may have to pay for the catalog, $7, but beyond that, all procedures are included in your monthly membership fee. Now, I still encourage my members to have insurance, particularly catastrophic insurance. Though I work in an ER from time to time, this is not an emergency room. And if, heaven forbid, you are involved in a car accident or fall off of a roof and need an emergency department for care, it's good to have insurance to cover those types of things when you're not seeing a direct primary care doc. You know, sometimes I hear people say, hey, I already have insurance, so I don't want to pay an extra fee to see my physician. Well, I say to you this, you still pay co-pays for most insurance programs. And are you getting the quality care you feel you deserve? Do you get to spend more than 15 minutes discussing your issues with your physician? The odds are likely no. Not many of you can directly text your physician if you have a question and you don't want to set up an appointment so that you can wait 2 hours to be seen for 15 minutes and not actually have your question answered. That is what direct primary care provides. A physician who will give you an hour every appointment. If you don't need it, we don't use it. But you have the time to discuss your issues with your physician directly. On top of that, you can text them, call them, whenever you need to. That's what you get with direct primary care. And that wraps up this episode of 5 Minutes with Your Doc. Today we've been talking about direct primary care, in particular Titan Health. If you have any other questions about direct primary care or anything else that we do here, please feel free to visit my website or give me a call. Let's talk about it. Thanks, guys. Have a good one. I'll see you next time.